The Nigerian Investment Promotion Commission has called for public-private sector integration to enable Nigeria's healthcare industry become an investment attraction center in Africa and revive medical tourism. The acting Executive Secretary and Chief Executive Officer of the NIPC, Mr. Emeka Ofor, was speaking at a strategic stakeholders meeting on draft national policy on incentivizing the health service industry and healthcare investments being championed by the Healthcare Federation of Nigeria. Mr. Ofor notes that this document will drive growth and overall transformation in Nigeria's healthcare industry from its current state. On her part, President of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi, notes that this draft will seek to challenge issues around raising capital, especially for the private healthcare sector, and the easy access to foreign exchange. She also calls for more provisions of incentives to bridge the gap between public health sector and private health sector in Nigeria.
You will know that a lot of funds, about 348.7 trillion naira, is required as investment into the national economy for the next 5 years under the National Development Plan. The idea is that NIPC will now begin to mobilize both the public and private sectors to get these funds in place. As we get them in place, it will be easier for us to develop the sector, the investment space in Nigeria, attract investment to the sector, for instance, employ or create jobs for millions of Nigerians and create wealth as well. So the idea behind this draft policy is to mobilize the private sector through support of the government to ensure that investments come into this sector.
For a long time, the public sector has worked aside and private sector has been seen on the other side. Now they're building a bridge called public-private partnerships, and public and private are working together. But what I am calling for, or we are calling for as a healthcare federation, is for public-private integration. We serve one public. Let us work seamlessly together to provide service for that public.